Hello, my name is Nawari McGowan, and I will be presenting how bedside reporting and the change theory complement each other. The change theory of nursing was created by Kurt Lewin, who is considered the father of social psychology and well known for his writings on group therapy, group dynamics, and social psychology. This theory is his most influential theory, and it involves a three-stage model of change known as the unfreezing, change, refreeze model that necessitates prior learning to be rejected and replaced. Lewin defines behavior in this model as a dynamic balance of forces working in opposing directions. The change theory has three key concepts: driving forces, restraining forces, and equilibrium. Driving forces involve factors that push in a direction that causes change to occur. They facilitate change due to the push for patients to go towards a desired direction, causing a shift in the equilibrium towards change. Restraining forces are factors that counter the driving forces by hindering change because they push the patient in the opposite direction. This leads to a shift in the equilibrium that opposes change. Equilibrium is a state of being where no change occurs due to the driving forces equaling restraining forces. This state of balance can be raised or lowered by changes that occur between the driving and restraining forces. My CSP project is about improving important communications between nurses and patients with the use of bedside reporting during change of shift. Using this theory to my project, the driving forces that have been identified are positive patient engagements that individualizes their treatment options with improved patient safety. Other forces increased patient satisfaction, improved safety measures, increased nurse accountability, and better understanding of illness from the patient perspective. Unfreezing is a method which involves finding a process of making it possible for people to let go of an old habit that was somehow counterproductive. This is pertinent to overcome the strains of individual resistance and group conformity. Three methods were identified to lead to the achievement of unfreezing. First is to increase the driving forces that direct behavior away from the existing circumstance or status quo. Second, the restraining forces that negatively affect the movement from reaching the existing equilibrium needs to be decreased. And the last step involves finding a combination of the first two methods. The change stage, which is also known as moving to a new level or movement, incorporates a process of change in thoughts, feeling, behavior, or all three that is in some way more liberating or more productive. The refreezing stage is creating the change as the new pattern so that it now becomes the standard operating procedure. Without this final stage, it can be easy for participants to go back to old habits. Change theory is applied to my CSP. The unfreezing process would involve changing nursing change of shift reporting from the nurse's station to the patient's bedside. In this step, I would increase the driving forces of improved patient engagement, patient satisfaction, patient safety, and nurse accountability. For the second step, I would provide education to all nurses to demonstrate how this new practice change is beneficial to both parties, that's the nurses and patients alike, how resistance to change will hinder positive improvements, and how change in this manner should be a more permanent one to increasing driving forces. For the last step, I would gather information from the nurses once the practice change has been implemented to incorporate how well they feel this new practice change is working and receive any suggestions that can improve upon bedside reporting for a smoother transition. By collaborating with the nurses, the change stage can take place because through their experiences can the adaptation of care evolve into something more optimal for patients. Lastly, the refreezing stage would make bedside reporting the new normal and make the old habit of completing change of shift reporting at the nurse's station an outdated practice.